Hello, everyone. Thank you for joining us today. I'm Alexander Zhao, a board-certified Permanente gastroenterologist practicing in Northern Virginia. I have an interest in managing patients with chronic liver disease, and I'm part of the Mid-Atlantic Service Liver Committee. I am joined today by my incredible physician colleagues, Dr. Alexis McCary and Dr. Mitchell Kang, both board-certified gastroenterologists, and we are very excited to be talking to you today. Dr. McCary, do you mind introducing yourself?
Hi, I'm Alexis McCary. I'm one of the gastroenterologists for Kaiser Permanente in the DC suburban Maryland region, and I have a special interest in hepatitis C and fatty liver disease, and I'm doing research on that at this time.
Great. And Dr. Kang.
Hi, everyone. My name is Dr. Mitchell Kang, one of the board-certified gastroenterologists, also in the Northern Virginia region. I practice general GI. Happy to join you guys today.
Thank you both for joining us today and sharing your expertise with our audience. Today, we're talking about a very important topic. So millions of people in the United States are currently living with viral hepatitis, and thousands of new cases are being reported every single year. With proper management, these are very treatable diseases. However, patients need to be diagnosed to receive access to life-saving care. And in many cases, 40 to 60% of these people infected aren't even aware of their diagnosis, putting themselves at risk for health complications such as liver failure, liver cancer, and even death. May is Hepatitis Awareness Month, and it's a great time to learn more about the different types of hepatitis, diagnosis, prevention tips, treatment options, and more. By raising awareness and understanding of hepatitis, we can encourage individuals and communities to really seek testing and treatment and reduce the impact of undiagnosed and untreated viral hepatitis. I'm excited to have this conversation today with my panelists, and we are looking forward to your questions. So if you are watching live, please post them in the comments on Facebook. So Dr. Kang, why don't you just start out with us? What is hepatitis? What does that mean?
Sure, Dr. Zhao. So hepatitis is a general term meaning inflammation of your liver. So the liver is an essential organ in your abdomen, and there's many important functions. It's important to help for detoxing the body. It can also store very important vitamins and nutrients, and then also helps fight off infections. So when your liver becomes damaged or inflamed, it can affect the function. This can lead to impaired metabolism of drugs or the buildup of toxins. It can also affect the liver's ability to make certain clotting factors and proteins that are essential for normal blood clotting and cell function.
So obviously a very important organ. So, we get this a lot, what are the different types of hepatitis? And, how do I know? So Dr. McCary, can you kind of break it down to us? What types of hepatitis are there? And what should we be focusing on?
Right. So as Dr. Kang mentioned, hepatitis is inflammation of the liver. And today we're primarily focusing on the viral hepatitis that can affect the liver. And there are 3 different viruses that target the liver that are the most common causes of viral hepatitis. They're hepatitis A, hepatitis B, and hepatitis C. And depending on its course, the hepatitis can be acute, meaning it flares up suddenly with symptoms and then goes away, or it can become a chronic long-term condition that causes chronic liver disease. Hepatitis A is an acute infection only, and it resolves after a few weeks. People usually improve without treatment, although in some cases treatment is required, but in most cases it's supportive care, IV fluids, nutrition, that kind of thing. And after the hepatitis A course, it flares and it resolves after a few weeks. Hepatitis B and C, they can present in the acute setting, but they typically are identified in the chronic setting, meaning the patient has chronic persistent infection, and that can cause the chronic liver disease.
Great. And so how do people get A, B, and C? Where do we worry about these things? What are the major kind of risk factors for that?
Yes, so hepatitis A is the virus is found in stool and in blood. So it's transmitted through contaminated food or water. So that's why we sometimes hear about food outbreaks. It can also be transmitted person to person. So that can be with sexual contact, or it could be just for caring for someone who has the virus in a setting like a nursing facility or a daycare setting. Hepatitis B is found in blood and bodily fluids, and it's transmitted through those two, through blood and bodily fluids, not stool. One of the common modes of transmission is from mother to child during pregnancy or during delivery. So the rate of transmission from mother to child in a mother who has hepatitis B, the rate is 90% when the mother has acute hepatitis B and 20% when the mother has chronic hepatitis B. It can also be transmitted sexually, as well as with the use of non-sterile drug injection needles, contact with blood from open source from a person who has hepatitis B, needle stick injuries in the healthcare setting. It can also be transmitted from sharing items that may have blood on them. So for example, razors or toothbrushes can have small amounts of blood, and hepatitis B can survive outside of the body and remain infectious for at least 7 days. So this is a potential way to contract hepatitis B.
And Dr. McCary, you actually raised some interesting points, in terms of, places in the home where you can see, blood and hepatitis C, such as toothbrushes or razors. Are there any specific precautions you tell patients who may have hepatitis C that they need to exercise, within their own families or within their own homes?
Yeah, so for hepatitis B, one of the ways to prevent spreading the virus is by having household contacts vaccinated. And I think we're going to discuss that a little bit later, but having your household contacts vaccinated with hepatitis B will protect them from contracting the virus. Now, for hepatitis C, we don't have a vaccine just yet, but so in those situations, it's important to not share things like razors and toothbrushes. But it's also important to realize that hepatitis C cannot be shared by eating utensils or hugging someone with hepatitis C or holding hands. And it's also not spread through food or water. So hepatitis A is very infectious because it's spread through the stool, but hepatitis B and C are spread through the blood only.
Thanks for clarifying that. That's a very common question we get. Dr. Kang, are there certain people or communities that, we need to kind of screen for, or at kind of particularly higher risk for these type of different hepatitis A, B, and C?
Yeah, absolutely. So Dr. McCary did a great job explaining how you can get each of the viral hepatitis types. So I'll walk through kind of based on how you get each one, what that means in terms of which certain groups are at higher risk for getting them. So for hepatitis A, as Dr. McCary mentioned, it could be passed on through the stool, and so through contaminated food and water. So hence, our homeless population is at a higher risk of developing hepatitis A. Also, those who have had close contact with someone with known hepatitis A are more prone to getting it or at higher risk. Also, international travelers, men who have sex with men, and those who use or inject drugs are at higher risk for those. For hepatitis B, so infants who are born to mothers with known hepatitis B, as Dr. McCary mentioned, people who are born in certain countries where the rates of hepatitis B are very high, those who have been incarcerated or have had intercourse with people who have been known to have hepatitis B. Also, we have to think about the people who are our healthcare workers and public safety workers who have been exposed to hepatitis B on the job, and then patients on hemodialysis because of the blood.
Got
For
it.
hepatitis C, those who use or inject drugs or share needles is certainly one group that's at high risk for that. Also, people who have received a blood transfusion or organ transplant before July 1992, because that's when the universal screening came about for testing our blood supply for hepatitis C. Also, people who have known sexual intercourse with people who have hepatitis C. And then once again, our healthcare and public safety workers who have been exposed to blood on the job.
Great. Just going back to hepatitis B, you said there are some endemic areas in the world. Can, any specific countries or continents that you're referring to?
Yeah, certainly Africa and Southeast Asia. So a lot of those countries have high endemic rates, and that's why it's very important that we test for hepatitis B once they immigrate to this country to see if they have the chronic condition.
Great. In terms of who gets screened and how do we even know that you have a hepatitis? Dr. McCary, can you tell us a little bit about, how do we screen for these different viruses?
Yeah, so the way to screen for hepatitis B and C and even A is with a blood test. And these tests typically detect the virus in the body or detect antibodies to the virus. And the antibodies are blood proteins that your body produces in response to having been exposed to a virus. So our screening test tests for those. And if the screening test is positive to suggest hepatitis B or C, then there are additional tests that we have available to confirm the diagnosis, additional blood tests.
Okay, great. Um, you know, in my practice, I get a lot of referrals from physicians, after they've already made the diagnosis or they have a positive screening test for hepatitis. But, I think for our viewers out there, the question often comes up, how do I even know that I have hepatitis? What are the symptoms that maybe I should be concerned about and talk to my doctor about potentially testing for these? So, common symptoms that I tell my patients that they may experience if they get hepatitis. Unfortunately, for a lot of patients, completely asymptomatic or mild symptoms, and they may not even know. They just may feel run down, under the weather, fatigue. So again, some symptoms may just be very, very subtle. Low-grade fever, fatigue, some gastrointestinal symptoms such as nausea, abdominal pain can be generalized, but oftentimes maybe predominantly in the right upper quadrant where your liver is located, sometimes loss of appetite. Where you should really start looking for, seeking medical attention if you start to see that you're jaundiced. And what does that mean? That means you start to develop yellow eyes, or your skin color starts to get a little bit more yellow, and that can be actually difficult to evaluate if you have a darker pigment. Sometimes your stool may change color, so it may be a more clay colored stool, or dark urine, which could be a sign of increased bilirubin in your urine. And so those are often things that you should look out for. But again, those cross over with a lot of different other viral symptoms and infections. And specifically in the COVID era, it can be very hard to determine, if you're, have symptoms of hepatitis. Again, just in summary of the hepatitis A, B, and C, for hepatitis A, most people, 70% actually will have some sort of symptomatic illness, but that will recover, within a couple of months. Most people will recover. So hepatitis A is a very self-limited type of infection. Hepatitis B, actually, only 30% of people will develop a hepatitis with jaundice. So again, the vast majority for hepatitis B infection, 70%, may have very subtle or mild clinical course and may not even know that they're infected. And then same with hepatitis C. It's asymptomatic in about 2/3 of patients. So 2/3, when we get people with hepatitis C and we ask them, have you ever been sick? Did you ever have jaundice? Probably 2/3 or more may not even remember any type of hepatitis symptoms. And that's why screening is so important in identifying these patients. So kind of moving on, we touched upon this, and I think we should just flush it out a little bit. Dr. Kang, tell me a little bit about, you know, some strategies we have in terms of preventing hepatitis, vaccines or things like that.
Sure. Yeah. So for hepatitis A, one thing we do recommend is that you practice good hand hygiene. So that's things like thoroughly washing your hands after using the bathroom, changing diapers before preparing or eating food. And that can help prevent the spread of hepatitis A. But as Dr. Zhao was just mentioning, the most effective ways to prevent both hepatitis A and B is through vaccinations. So for hepatitis A, there are two types of vaccines. The first one is a series of 2 doses, and it's spread apart by 6 months. The other combination vaccine actually gives you protection against both hepatitis A and hepatitis B. And so that would involve a series of 3 shots over the course of 6 months. These vaccines, both types of hepatitis A, are very, very effective. Also, they're very safe. Really, the most common side effect that I hear from my patients is that they'll have maybe a little bit of soreness or redness at the injection site, but really no serious side effects have been documented or reported from either of the vaccines. For hepatitis B, so there's actually 7 different types. You don't have to remember every single one of them. Just know that most of them are a series of 3 doses that are that cross about 6 months. And there is that combination vaccine that I was mentioning. So that can protect you from both hepatitis A and B, all in the series of 3 shots. Just like the hepatitis A vaccines, they're very safe, very well tolerated. Really just the most common side effects that have been documented or reported are mild fever and injection redness. But once again, no serious side effects. So we really recommend that you get vaccinated. Now for hepatitis C, unfortunately, there's no vaccine available right now for that.
And Dr. King, who's eligible for vaccinations? Can anybody get it? Are there certain patient populations that we are concerned about giving immunizations, or do we do them any differently for certain people?
Yeah, that's a good question. So we definitely recommend, the hepatitis B vaccine for really anyone. You'll see that the infants get it very early on, so it's usually well before they hit adult stages. But really, if you haven't been vaccinated yet and you're an adult, highly recommend that. Really, the CDC recommends that all adults get vaccinated between the ages of 18 and 59. And then if you're above 59, if you have certain risk factors, the CDC recommends you get vaccinated for hepatitis B.
Got it. And if I get a vaccination for hepatitis A or B, am I immune for the rest of my life? Do I need boosters, anything like that?
That's a great question. So for hepatitis A, yes, once you get the infection, you are pretty much good for life. So you get a lifelong immunity where you don't get the infection ever again. For hepatitis B, it depends, I would say. So in most people, it does last and give you immunity for 20 to 30 years. However, in some populations, they'll have the immunity wane and won't get the antibody levels kind of at the where we want them to. And so we'll recommend certain booster vaccines, but those are only for certain populations. So for example, patients on hemodialysis with low antibody levels, I will recommend that booster shot for them.
Thanks for that summary. Moving on from vaccines, which is, prevention, now you have hepatitis, A or B or C. Is these treatable illnesses? What are our options, Dr. McCary?
Yes, so for hepatitis A, the treatment is typically supportive care, rest, adequate nutrition, and fluids. As I mentioned before, hepatitis A is acute, so patients recover from it, and then there's no need for medicine because it won't become a chronic problem to cause chronic liver disease. Now, for hepatitis B and C, we do have medications for those 2 viruses. For hepatitis B, in the acute setting, patients typically require supportive care, but in some cases where patients are extremely ill, they may need antiviral medication. But the antiviral medication that we have available, we typically use it for chronic hepatitis B, and in certain patients with a certain virus level or a certain degree of inflammation in the liver. But the thing about the medication for hepatitis B is that it's not curative. It keeps the virus level low, hopefully undetectable, but it doesn't cure the hepatitis B. So most patients end up taking the medication for many, many years, sometimes lifelong. There are instances where patients are able to come off of the medication, but as of now, the medicine is a chronic medication that's used to suppress the virus level. Now, the good news about hepatitis C is that we have new medications to treat hepatitis C, and they are curative. So compared to medications we had 10, 20 years ago, the new antiviral medications that we have for hepatitis C are curative. So they're more effective and they're better tolerated, fewer side effects. Patients sometimes have a little bit of fatigue. Some patients get anemia or insomnia, but these are all things that we can treat while the patient's on the medication. And it's curative, so the patient takes the medication for 8 to 12 weeks, and then over 95% of patients are cured after this type of regimen.
Yeah, I mean, this development of Hep C antivirals is really groundbreaking. I mean, I remember early on in my training, I don't want to age myself, but maybe almost 20 years ago, when they used to have to give interferon for hepatitis C, and these were, almost 1 year therapies, very, very high dropout rates just due to just poor side effects and interactions, and very, very low cure rates. So it's amazing that we can get cure rates over 90% at this point. Are there any certain considerations we need to know about if we're starting patients on antiviral therapies, that contraindications or considerations in terms of dosing?
Yeah, so there are several antiviral medications available, and sometimes we have to take into consideration comorbidities or other medications that patients are on. And then certainly some patients with advanced cirrhosis, it may be more detrimental to start the medication, and so the medication might not provide as much benefit. It could make the patient more sick. So there are certain situations we have to take into account whether or not to treat the patient in the first place, and then also which of the various antivirals we would select.
Got it. So, I see this a lot in my practice as part of the liver committee. So I often deal with patients with a more end stage liver disease, and just want to kind of talk about a little bit of the trajectory of untreated hepatitis, what it may look like for some. So with viral hepatitis, this is a chronic process. This virus attacks the liver, these liver cells get injured and die, and this process causes scar tissue. And while this process of scar tissue formation or fibrosis happens over many years and decades, if the entire liver becomes scarred, this can, cause shrinking and hardness of the liver and irreversible damage called cirrhosis. Now, Dr. Kang summarized really nicely all the functions of the liver, including metabolism, protein synthesis, detoxification of the blood. And so if you develop cirrhosis of the liver, you have impairment of a lot of these very important functions. And so we start to see decompensation or symptoms or complications of chronic liver disease in about 10% of patients with cirrhosis every year. And this may look like gastrointestinal bleeding, which can occur. Sometimes we see confusion or altered mental status, and this is as a result of your inability to detoxify certain components in your blood, such as ammonia. We can see retention of fluid in both your abdomen. This is called ascites, sometimes actually in other areas, including your lungs. And sometimes we see things like chronic kidney disease, loss of kidney function for people who develop symptomatic cirrhosis. And then, of course, liver cancer also can be a complication of chronic liver disease. So when decompensation occurs, the risk of hospitalization and death really increase significantly. And sometimes the only treatment at that point is transplantation of the liver. So this is receiving a new liver from either a donor, a living donor, or a cadaver deceased donor. And certainly the reason why we're having this discussion is early detection saves lives, vaccination prevents hepatitis, and we're trying to get everyone out of that pathway to get to this point of decompensated liver disease. So kind of going to the social implications of cirrhosis and hepatitis, Dr. Kang, tell me a little bit about kind of the history of hepatitis C, and are there any stigmas attached to this diagnosis and infection?
Yeah, Dr. Zhao, unfortunately, there has been a stigma associated with hepatitis C. For whatever reason in the past, it's been previously associated with illicit drug use and promiscuous behaviors. So I think that's where it got kind of that social stigma. But as we previously mentioned, there's a lot of causes besides those two of how people may contract the virus. So that's one of the things I really love about Kaiser is that we have a very positive and non-judgmental environment here with our providers. So we try to encourage you to get tested early on, because as Dr. Zhao just mentioned, the earlier you get screened and tested for it, the more effective the treatment is, and also the better outcomes you may have, where you may prevent the long-term complications like needing a liver transplant. So it's very vital from our standpoint that you get tested early. And like Dr. McCary mentioned earlier, the antiviral therapies now that we have are so successful. The cure rates are greater than 95%, as she's mentioned. So they're much better than the interferons and the ribavirins that we used to have many, many years ago.
Yeah, I mean, absolutely. I think a lot of times when I've discussed testing for hepatitis C in some of my patients, the first thought is, why do you think I would have hepatitis C? There is kind of this thought process that you must think I use needles, or I may have history of drug use. And quite frankly, in my experience, I think in the vast majority of the time, I can never really determine the real risk factor of why they may have gotten hepatitis C. And in my practice, that really doesn't matter. We have such good treatments available. If you have it, you should get it treated. And so that I really think has become less of kind of really an issue. And certainly, hopefully, we can kind of demystify that stigma. Um, so, again, I think just want to highlight kind of what we're doing at Kaiser, because I think we do such a great job of screening people and identifying people who have hepatitis C. Dr. McCary, can you tell us a little bit about this hepatitis C pathway that we have available here at Kaiser Permanente?
Sure. So in 2014, Kaiser in the Mid-Atlantic region launched a comprehensive hepatitis C virus screening model designed to improve detection and treatment of the virus. And this has been recognized even by the World Health Organization as an excellent strategy for screening patients for hepatitis C. So the model includes automated alerts in our electronic medical records to us providers, so that we are reminded to screen patients because they have a risk factor, specifically if they were born between 1945 and 1965, so baby boomers, and then any other of the risk factors. This is a way for us to be reminded, has this patient been screened? Also in our screening process, the lab testing is automated so that there is automated confirmation testing if a patient has a positive screening test. So that helps to expedite and helps to make sure that the patient actually goes through with the full screening process and the confirmation process. In addition to the testing, the model also includes a way to integrate screening for liver fibrosis or scarring. So there's a new device called FibroScan or transient elastography, where we are able to estimate the presence and degree of liver scarring. And we've integrated that test into this model. That way we can not only identify patients with hepatitis C, but also those with advanced liver fibrosis. And then finally, we do have hepatitis C care coordinators who assist with all of this, and they're invaluable in making sure that we remember to follow up these patients and get them screened. So that was in 2014, and we've been continuing with that. It's been very successful so far, and so successful that in 2017, a similar program was launched for hepatitis B with similar features.
Yeah, I mean, such an amazing resource, these coordinators. I think I saw, before this was all rolled out, we were getting screening rates of hepatitis C kind of more in the range of 20%. And now over 85% of the population that can be screened has been screened at Kaiser Permanente, which is just amazing. It's really great. I mean, I don't think I go a week without a referral for someone who is now a candidate for treatment that I can cure their hepatitis C. So just to kind of really drive the point home, hepatitis C is really a easily screened for infection, treatable with cure rates of 90 to 95%, which is just kind of unheard of, previously in the antiviral era. And pretty much anyone who has hepatitis C is a candidate to be treated. So you don't have to be the sickest of the sick. You don't even need to have fibrosis or cirrhosis. If you have hep C, we want to treat you. So any adult over the age of 18 with hepatitis C can be treated. Talk with your primary care doctor about that. And then certainly when you go through the pathway, our hep C coordinators are in a an amazing point of care, and they get everything that is needed before you even meet us in the gastroenterology clinic. And really, we can start that discussion of treatment options and working with our pharmacy department, getting the right medications for you. So, last thing I just wanted to ask, of, either Dr. McCary, Dr. Kang, are there any things in the horizon that seem concerning in terms of trends with hepatitis C infections? Because, I thought with medications, this would pretty much be a virus that is going to be obsolete. Are we seeing that? Anybody?
Well,
Yeah.
I'll jump in. I would say that, one of the things we have to remember is that patients with hepatitis C can sometimes have other other comorbidities that affect the liver. So if they have metabolic syndrome, they could have fatty liver disease, and then they could also have concurrent alcohol hepatitis. So I think one of the things we have to remember is how the hepatitis C perhaps, exacerbates some of these other liver disorders.
Absolutely. Yeah. I always, when I counsel my patients with Hep C, and even when they get cured, it's a reminder that there are other causes of hepatitis and you still need to manage those risk factors. So often concurrent alcohol use, as Dr. McCary said, fatty liver disease is, rising to the top as one of the number one indications for need of liver transplant. So certainly those things, obviously a huge topic in itself, and hopefully we'll be able to discuss that at another session. In terms of what I have been kind of seeing in terms of the CDC trends, is actually there is a concerning trend of increasing infections amongst the millennials. So we're talking kind of my generation now, and this used to be something that I thought was more of a baby boomer generation thing, and we are seeing that, and primarily I think it's because of this increasing opiate epidemic that we're seeing. And certainly we are seeing younger people who previously may not have been people we would identify as higher risk patients, or people who are actually getting new infections of hepatitis C. So again, the screening recommendation, CDC changed it so that anyone over the age of 18 really should be screened for a one-time screening of hepatitis C. And if you have increased risk factors, actually likely need to be screened more than once. So just wanted to see if we have any questions, but if not, Dr. McCary, just wanna, in your words, any final statements, any summaries that, sticking points that for our audience today that you just wanted to highlight?
Yeah, I think the screening test is easy. It's a blood test. And if you go in for your annual physical, just, if you haven't been screened before, just ask your primary care doctor, can you add on that blood test? It's as simple as that.
Great. And Dr. Kang, any final words of wisdom?
Yeah, I'd say it's important to get screened early, and also the treatment is amazing now, as we all have kind of hopefully drilled down that the treatment is really, really effective, and it's really now just a pill for 3 months, where in the past it used to be for more than a year. So all this is just 3 short months, and you're going to be cured most likely. So that's my takeaway there.
Great. Dr. McCary, Dr. Kang, thank you so much for joining on this really, really informative session. Thank you everyone for joining us today for this Facebook Live event. For more information on this topic and thousands of other health topics, visit kp.org/doctor. And from all of us at Kaiser Permanente, be well, take care.
Bye-bye.
Bye.